My name is Paul Siffri. I'm an orthopedic surgeon here with Steadman Hawkins Clinic of the Carolinas, which is part of the Greenville Hospital system. I've been in practice as an orthopedic surgeon now for 6 years. I have a special interest in sports medicine, in particular acute and chronic injuries of the knee as well as shoulder injuries. I primarily practice out of two offices. I have one office here in Greenville at the Patewood Medical Campus and a second office down in Simpsonville at the Hillcrest Memorial Campus. Ultimately, what propelled me towards medicine was in college. I actually was going to be a math major, and my father actually became ill with an orthopedic type of cancer and actually passed away from that. And seeing him through that and seeing him deal with the orthopedic surgeons and the oncologists is really sort of what gave me that extra push to go into medicine. My undergraduate education was here in Greenville at Furman University, and I was there from 1988 to 1992, and actually was fortunate enough to be a member of the national championship team in 1988. And you know, I'd planned on going to medical school right after college, but fortunately I got the opportunity to play professional football right after college, and so played a year for the Pittsburgh Steelers in 1992. And then after I finished playing football, I wanted to see what else was out there besides medicine. So I took a couple other jobs. One, I worked with a company called Arthur Anderson, which used to be one of these big six accounting firms, and worked for them for a year and realized the business world wasn't for me. And then I said, well, maybe I'll try physical therapy, and actually went and worked as a physical therapy aide. And after I tried those two different career paths, I went full circle back to medicine and realized indeed I did want to go to medical school. So at that point, I applied to medical school and was accepted down in Charleston, South Carolina at the Medical University of South Carolina, and finished medical school and went up to Charlotte, North Carolina and did my orthopedic residency. And after I finished my residency, I had a desire to do an extra year of training called a fellowship, and went up to New York City and did an extra year focusing on the knee and on the shoulder in sports medicine at Lenox Hill Hospital in Manhattan. I remember vividly when I was at Pittsburgh, I injured my knee, and it was actually the last play of practice, and tore my meniscus. And luckily didn't have to have surgery, but I did have to miss about a month of practice. I had to go through pretty intense rehab, and it's really helped me a lot to relate to my patients, especially those patients who are having to miss time away from either their sport or what their active lifestyle allows them to do. I never take it lightly telling a patient that, hey, you know, you got to lay off of whatever activity it is for X amount of time, because when it's part of someone's lifestyle and you're having to have or ask the patient to change that lifestyle for a short period of time, it's a pretty big issue. And so I think having that injury and having been laid up like I was has really helped me to relate to those patients. The fun thing about medicine is that it is ever changing. And the fortunate thing about being part of a university medical center, such as Greenville Hospital System, is it is incumbent upon us as physicians to stay on the cutting edge. And the reason being is we are teaching future orthopedic surgeons, both through our residency program and our fellowship program. So if we don't stay on our toes, so to speak, and keep up with the latest and greatest, we are not going to do justice to the residents and the fellows that we're training. When I'm discussing surgery with a patient, I try to speak in layman's terms, and it's just very important that the patient's well informed. Medicine has changed a lot over the past 20 years. 20 years ago, the doctor says something, and it is so, and that's the way it used to be. Nowadays, it's really a team approach. It's the patient-physician relationship that's more important than anything else. The patient needs to be comfortable with their surgeon, but more importantly, the surgeon needs to make sure the patient is comfortable. The patient knows what's going on with them and knows what the different options are. I can truly say I wake up every morning looking forward to going to work. You know, I could be having a tough day, so to speak, but if I can get one hug from a happy patient, that's the most important and the most rewarding thing that I can find in my practice. I think as orthopedic surgeons, we have an opportunity to really affect patients' lives. In general, our patients are patients who are, in general, very active and very healthy, and they want to stay that way, but maybe have sustained an injury or developed some arthritis. And when we can have an impact on their lifestyle, it's an extremely rewarding job. You know, I have a passionate interest in golf, and I think the reason being is because I'm not a good golfer, and with my personality and my competitive nature, I'm gonna keep playing until I get better. Now that may never happen, but if I could play golf every day, I would. What I'm most proud of, I guess, in life would be my family and my two boys, and completely has changed my perspective on life. And I think that's even translated to my career as well.